my name is Darshan Chandramohan. I'm a medical student just finishing up my first year here at the California University of Science and Medicine. CUSM is a medical school that is affiliated with Arrowhead Regional Medical Center in Colton, California. We have a 4-year MD program. We also have a master's program for biomedical sciences. During my first year, I've been fortunate to take a number of classes learning about different systems in the body, and one of our longitudinal classes is clinical skills, which we do here in this space, where we learn about the actual more hands-on aspects of medicine. First year medical students, it's we don't want to be practicing on real people. So we have extremely high fidelity simulation mannequins such as the SIM man here, which enable us to sort of deal with real clinical scenarios, stuff that we would see, and actually get hands-on experience. So this mannequin does everything from blinking to coughing, as you can hear. He also has real-time vitals. So his heart rate is being monitored. This trace up here is what we call an EKG, electrocardiogram, and his breathing and various aspects of his blood flow and the amount of oxygen. As you can see, even his chest rises with his breathing rate on the monitor. One of the things that I did the last time I was here for a simulation activity was actually verify that you could check the pulse in the arm, in the neck at the carotid artery, and at the feet even, which kind of surprised me. But one of the places where you might take a pulse is in the dorsalis pedis artery at the top of the foot. And it was very impressive to me that at all of these locations on this one mannequin, the pulse could be felt. So the simulation mannequin is actually used in a number of simulated cases. And the details of that case can be programmed ahead of time on this computer. And the case can respond to different interventions that we might try to do as sort of practicing medical students. So one of the things that we could do is give our patient different kinds of medicine. And for example, recently we simulated an emergency situation where a patient had fainted and come into the emergency department. So the first thing that we do in that case is check the airway, breathing, and circulation. And after that, we come up with a list of problems that we want to treat, and we treat them. So for our patient, it turned out that he had an arrhythmia. So we did give that patient amiodarone, which is a drug that's used to treat certain types of arrhythmias.
Now, all your medications over there, those are simulated medications, correct?
Yes. So these don't actually go into the patient, but we can sort of prepare the appropriate amount, pretend that we're administering them to the patient, and after doing so, actually a person, one of our professors who would be monitoring the activity, would actually make a change on this laptop that would be reflected in a change in either the vital signs of the patient or some other aspect of the status of the patient. So as you can see, if the heart rate were to drop as a result of the medication, that would happen in real time. And as you can see, there's a pulse low alarm that goes off as well. So if we were to treat this patient and then give a medicine such as butamine, then we might see the pulse come up.
When you practice giving the medication, you guys are making the call as to which medication, and you call out how much and what the name is?
Yeah. So actually it was exciting because that's something that we aren't totally aware of at the moment. So we're still learning what the medications are and what they do. So things such as dosage are sort of challenging for us to figure out. And we actually did an interprofessional activity with pharmacy students from Marshall Ketchum University, who came and basically informed us like what the appropriate dosage is and how to administer the medications. So for example, some of the medications have to be administered continuously, so they're placed into an IV instead of directed directly into the patient.
And when you guys practice your codes, tell me about the team dynamics that you guys have.
Yeah, so it can be challenging. The last time my role was actually as the team lead. And if I can direct you over here, one thing that you'll notice right here, there is a green box and tape on the floor. And the team lead can't leave that box. The team lead has to stay there and basically direct everything that happens from within this box. And the reason for that is if the leader is engaged in some activity, for example, checking the pulse or whatever, they lose this sort of high-level situational awareness that you need to be able to direct and coordinate these sort of really complex activities. And so individual people might be focused on individual activities, but the leader is supposed to be observing, communicating, and making sure that everyone is on the same page and doing the right thing at the right time.
Okay. I know that we've taught the students about, CPR and everything. So what are some of the different lead positions you have during a code?
Yeah, so for example, at the beginning, one person would be checking the airway to make sure that that's clear. One person would be monitoring breathing. So a student, for example, would be listening with their stethoscope to make sure that the lungs are inflating. And then someone would be assessing circulation. So someone would check the pulse. And that same person might also press on the finger to measure sort of what's called capillary refill. So we want to make sure that those are sort of at the top three of the list. And then another thing that really needs to happen early on is monitoring the patient's vital signs and so forth. So hooking a patient up to the EKG and the pulse oximetry and all of those other monitoring components, which actually, this is another thing that I tested. Like if you take this off, the SpO2 sensor actually goes off. So all of those little details that need to happen during a case actually do happen. So definitely like it was a good opportunity to see like where a pharmacist might fit into a sort of real-time response to an emergent situation, there were two students playing nurses and what their role is relative to the medical students, relative to the residents, and relative to the sort of team lead. It was an educational activity, but also sometimes felt like we were sort of thrown in at the deep end, because at that point, having barely just learned what the anatomy and physiology and what's going on behind the scenes, like we had to sort of integrate all of that with actually trying to deal with a mannequin, but something that is very resembles a real live human being. One of the things I noticed was one of my classmates who was at the head of the patient had to sort of respond in a human way whenever, the patient would cough, or the patient might vomit, or say that their head hurts. And like, even though it's a mannequin, one of those skills, or some of those skills that we're practicing, are just the human skills of being reassuring and being confident, and just communicating to patients that we're doing everything we can and everything's going to be okay.
Those are great skills. Good practice.
So this is sort of where the man behind the curtain sits, or our professors will sit here and sort of monitor what's going on in the room. And this is a one-way mirror, basically, half silvered mirror. So they can see in, observe everything we're doing. And this is actually where the laptop is kept, so that they're sort of updating the mannequin consistently based off of what we're doing. It's another opportunity to sort of take the training wheels off and have us run this show on our own, and respond to things in a more realistic environment.
And then afterwards?
Then we get a debrief where we sort of go over everything that we learned, discuss how we felt, discuss what was going on in the case, and how we responded, and what the actual correct approach to dealing with these situations would have been if we had made any mistakes, or anything that we might be able to do better in the future.
Okay, thank you. Here. Okay.
So this is one of our clinical skills practice rooms, where it's set up basically like you would expect to see in a hospital, an examination room in any hospital. There's a table, and we have standardized patients who are trained actors who are aware of what symptoms they should be presenting to us, and we go through a physical exam, so actually are able to take their blood pressure, measure their heart rate, measure their breathing, actually listen to their heart and lungs, which is something we did in this unit. And actually sort of some of the more subtle things about medicine. So one of the things that we do is percuss the patient, so actually listen to the sound that parts of the body will make when you sort of tap with your finger. And that's something that's challenging and takes a lot of practice to get right, because not only is the sound that we're looking for very informative on what's going on with the patient, but it's also really difficult to sort of tell the difference between some of these sounds, and also to reliably get a useful sound. All of the interactions that we have with patients are sort of scripted, and there's also an element of improvisation, where we basically are being asked to really treat this person as if they were an actual patient. And all of the interactions are recorded on video, so that we can learn from our mistakes, learn to do anything better that we can do better, and also get feedback from professors who will be watching those recordings.
Okay, thank you.
So this mannequin is designed to demonstrate heart and lung sounds. This guy has a name. This guy's name is Harvey. And his chest also rises and falls, and we have a stethoscope. This stethoscope, the person who is conducting the examination can actually listen using this pair of earphones, but there's an additional cord that enables the sound that's being heard through the earphones on the stethoscope to also be played out through a speaker in this base. So, for example, if we were listening to the pulmonary valve, the aortic valve, or the tricuspid or mitral valves, we could hear different murmurs, the sort of standard lub-dub two heart sounds, the S1 and S2 sound. and various other, and then we could also listen to the lungs and hear things like rails, which are sort of crackly noises that are indicative of sort of collapse of the little air sacs called alveoli.
So this mannequin is also adjustable by the computer to do different sounds?
So the adjustment for this mannequin is actually here on the device itself.
Oh, okay.
Yeah, so this is, I guess, more of a, like an in-person teaching tool. So our professor will be right here next to us, observing us going through the listening part of the exam, and explaining. And actually, one of the things that's really delightful is Dr. Javidi sort of went through the different sounds that we could expect to hear. He asked us to stand to the side after we'd listened to them, close our eyes, and just reflect on and commit those sounds to memory and think about like analogies. So, for example, the rails he compared to like crunching snow, or there was a heart murmur that we heard the other day that was compared to sort of the crashing of waves. So it's like a whooshing, like blowing kind of sound. So all of these really subjective things that it's hard to know. Like you couldn't reliably expect to see a patient in the hospital with all of these conditions. So in order to be able to actually hear these things and tell them apart and know where on the body we can expect to hear these sounds, a mannequin like this is sort of crucial.
Thank you so much for showing us around. And if you want more information, go to CUSM.org. Here's some of their web pages. And at the bottom of their web page, here's some contact information. Thank you once again for joining us, and I hope that you learned something today. Have a great day.